Good morning, folks. This is Carlton with Carlton's Travel Adventures. Another beautiful day in Medellin. Rained a little last night, but today is another beautiful day, man. Look at the weather out there. Great. This video is a very important video. It's about health insurance. Before I continue, there's one annoying thing about living here. These guys come around every day selling their fruits, avocado, mangoes, whatever, papayas. They have these megaphones that they scream things. And one thing, especially avocado guys, like, aguacate, aguacate. It drives you nuts for about half an hour. And one guy will come at the bottom of my apartment complex. He'll sit there sometimes for an hour. Just make noise, an hour, not kidding, an hour. Just won't move. And I cannot do any videos. Just wait till he leaves. One time I screamed down towards him. I think he probably cared. Get the hell out of here. Leave me alone. Some quiet peace. Understand you want to sell your fruits, but why disrupt the entire neighborhood? Sorry, that's my little thing. Okay, health insurance. Now, one of the main reasons a lot of us leave the United States, especially if we retire early, before Medicaid, is because of the cost of health insurance. We all know it's ridiculous. I wouldn't go there again. It's ridiculous. If you're working for a company, you're on their group policy, reasonable. It's getting more expensive, it's reasonable. You're on your own, try getting some insurance, it's ridiculously expensive. The deductibles are crazy. It can be $6,000, $7,000, $8,000 deductible before you start getting any, benefit out of it. So, if you watch some of my previous videos, see that, I was paying about $562 US, yes, over $500 a month, and when I left my previous employer, the bank, and to Cobra. Most of you guys should know what Cobra is. If you don't, look it up. I waste time going to Cobra. That's where you take up the entire cost of it. You can be in a group policy, but you pick up the entire cost yourself. Usually the company will pick up half or a certain percentage, 40%, pay the rest. But when you leave the company, you get to pay the entire amount. At least you get insurance. Now, when I was paying $562 a month, ridiculous. I think I paid that from about April, maybe May or April 2018 until December or January 2019. Okay? Quite a bit. I just want to be insured. Insured. I can insure myself, but you never know when you get older, things can happen and get you stuck with a $100,000 bill. Even though it's a lot cheaper here. So I settled on sewer insurance. I asked around and tell you sewer came in number one. You talk to local people, you talk to doctors, everyone. Sewer is supposed to be the best insurance policy. And to me it was reasonable. I tell you, I was paying, $1,780,000, a quarter, which is about $540 a quarter, okay? Or $180 a month, $180 a month, US, all right? Or that's $2,160 US a year. Not too bad, okay? Now, when I got the policy, I was never told, I don't recall ever being told, that there are certain age levels where the policy shoots up. Yes, the thing is getting older, you're gonna cost them more money, more claims, so it shoots up. One of the age is 60. When I got the policy, no one told me when next year, the year after, I turned 60 in July of 2019. So and the policy expires at January 28, 2020, 1 year. So no one told me that when you hit 60, the policy is going to shoot up. I didn't hear about it till, probably 6 weeks, a month ago, when my agent told me, hey, let's have a conversation. Your policy is going to probably go up significantly at renewal in February. I'm like, really? I didn't know that. Long story short, it said it might go up $100 a month. And I'm going, whoa, wait a minute. That's crazy, okay? But we're not sure, wait and see. Okay? Waited, and then I finally got the number, gonna go up about 25%. So I'm gonna be paying $2,237,536 COPS, or about $2,712 a year. Okay, just basically going from 180 a month to 226 a month US, or $46 a month increase. Ouch. Or about 552 for the year, which is basically 25% increase. I'm thinking about it like, wow, you know, can I afford it? Yeah, probably can afford it. Should I do it? I should do it. But keep in mind, not only paying that, once you get your cellular, you're required to take the government policy. Okay? Government policy, it was 103,600 pesos a month last year. Went to pay yesterday, it's up to 109,000 pesos. So it went up like a dollar. Okay? So let's call that $30 a month. So you gotta pay government policy for $30 a month, plus the private policy now for going to be $226 a month. So that's, if my math's right, going to pay $256 a month for insurance. Now, I've asked around quite a few people, Alexandra, my friend, and some other people, when I went for therapy on my hand, twice, sitting around the table, asked people around, just get some idea about how bad the government policy is. Because everybody said government policy, you know, it's crap, it's blah, blah, blah. But the normal Colombians can't afford the private policy. They all have government policy. I know a couple of expats who said they just have the government policy. You know, if you're not really sickly, not in the hospital all the time, it's not a big deal. Now, did I spend $2,000 US in services over the last year? Probably not. Okay, but it's sure is a great private policy. It is great. You know, when I had infection in my tooth about a month ago, you know, I just felt it swollen, just got infected. They came to my apartment like 11:30 at night with a portable chair, you know, and took care of it, you know, drained it and everything else, and a septic connect. So it's a good policy. You go to hospital for my colonoscopy, I pay $0. Go to hospital for endoscopy, whatever, I paid $0. It's a great policy, okay? Well, I'm glad I got my colonoscopy out the way, so I don't have to worry about it for another 5 years. So the policy is great. But do I want to pay that much money if I don't have to, if I'm pretty healthy? No, I don't want to pay much money. I can save $250 a month. You know, if I need to go to so I called in the emergency room at one of the best hospitals around here that I usually go to, Pablo Torin Uribe, you know, in Robledo, and said, if I came in emergency room and I didn't have insurance, how much would the visit be? It said about 70,000 pesos. I'm going, that's not bad. Okay, I can pay that myself, you know. Dental care is so cheap. You get a clean in, fill in, so cheap, no big deal. If I need to see a specialist, what would it cost to see a specialist? 70 to 100,000 pesos? Not too bad either. So I'm saying, maybe I should just go insure myself and just take the government policy. Pay $30 a month and that's it. You know, I'll save $226. If you go 2-3 months without any kind of issue, that's money you're saving towards basically self-insuring yourself. But you do have coverage, you do have the government policy. And I was told, you know, you can go to if you go to emergency room, obviously it's a government policy, you can wait there for 5 hours, 8 hours in emergency room to get care, okay? So that's the reason I call Pablo Torin Uribe, private hospital, and says, what would it cost? They say 70,000 pesos. I said, that's cheap. I can go there myself. If I go to emergency room and go to a government clinic and it's packed, I go over to, told me it says 10-hour wait, I go over to Pablo Torin Uribe and pay 70,000 pesos and get service right away, okay? So I spoke to one guy 2 days ago when I was getting my therapy done on my hand. He's probably a wealthier Colombian gentleman, nice, in the 30s. He worked for a bank. He got some problem with his hand. He can't feel it. But we had a good conversation for an hour, and he said he has both policies. That's why he's there with me. Obviously, he has a private policy for SORA, government policy. He said, man, I wouldn't count on that government policy. He said he had TB a couple years ago. He spent 6 months in the hospital for TB, and it would have cost him about 100 million pesos, I'm going, whoa, it's a big number. And I did the math, it's about $30,300. I'm saying, dire emergency, could I pay it? I said, probably could, okay? And I said, why don't you use the government, if you had a government policy, what would be the difference? He said, I probably would have died. Just an exaggeration, because I heard from a couple of expats that if you get really, really sick and you've got to see a specialist, they will put you ahead of the line and have you see one. In other words, you won't sit there and die waiting for a specialist, okay? And I can afford to see a specialist if I had to see one. So right now, I'm thinking about thinking about it, I've done it. Okay, I haven't called and renewed it. So throughout the year, I'm gonna update you guys on what it's like. If something happens, hopefully nothing happens. I'm pretty healthy. If something happens, I'll let you know my experience with the public policy, the public hospitals, public clinics, and so forth, okay? But let's face it, if something more serious happened, I'm not gonna go sit in the emergency room for 5 hours. Although if you're not emergency, get a book and sit and read for 5 hours. You're gonna get a chance to read my book. But if not really, really emergency, I go to Pablo Torre and Uribe and pay $70,000 for 70,000 pesos for a visit, 100,000 pesos for a visit. It's not that much money, okay, for care. So that's my experience here with health insurance. Good update for you. There are levels where SORA jumps up. 60 is a level, Then I heard maybe 65, but I haven't heard all the different levels, but I think 65 is another level. Or it could be, they could tell me again next year it's going to jump again another 25%. I don't know, Someone should have told me this from when I got the policy last year. By the way, your certain level is going to jump up quite a bit at 60, 62, or whatever the numbers are, okay? I think I heard it too late, in my opinion, okay? Unless I totally missed it. Anyway, good information for you, so you're aware of it. And a lot of people not aware that you have to take the government policy when you get your cellular. Everyone pays that, okay? Got a buddy of mine, he's been here for over a year, had the cellular, was not aware of that you have to pay for the government policy. He's going uninsured for the last year. I'm going, wait a minute now, you're not exactly young, you're in the 50s. Something happens, you go, like I said, I'll pay for it. But I said, just pay the $30 a month for government policy. Why wouldn't you do that? I mean, this makes sense. You have some coverage. So he said, okay, I'll look into it. I told him about 2 months ago and he still hasn't gotten it. He's a pretty healthy guy, so it's good. But just pay the $30 a month, government policy, and you're covered, okay? Anyway, just want to let you know about that in case you come here and you're looking for health insurance, okay? In case your agent didn't tell you that, I'm telling you now, all right? Thanks for listening. Don't forget to hit the like button. Have a great day. Thank you. I'm now uninsured. No, I'm not uninsured. I have government policy. It's okay. I'm good. Thank you.